Talk to me about the importance of finding a Lyme literate healthcare provider early on, because I've heard you talk in the past about the difference between chronic fatigue or chronic Lyme and acute. Can
Correct.
you talk about those different stages and why it's important to identify and treat Lyme quickly?
So Lyme can, when you're first bit by a tick, vector-borne insect, then the illness can start. You can have flu-like symptoms, headache, migraines, body aches, fatigue, and when that happens, it's much easier to treat with an intracellular drug like doxycycline, because the illness, the disease process the bacteria has not become smart yet. It hasn't had the chance to be able to be a chameleon-like and form a biofilm or a cyst form around it, or even around the body. So that's when you have to start interacting with other supplements and other antibiotics, and also that is...
And chronic, and if I understand correctly, chronic is basically hits people who have missed the early window of detection.
Correct.
And it's a much tougher battle.
It is a tougher battle, and you can overcome chronic Lyme. You can have symptoms that are left behind. You can have a little bit of chronic fatigue, you can have joint pain, you can have arthritis that is unfortunately left behind from some of the Lyme illness. But it's a longer road, it's a longer pathway for the individual, but you can overcome it. It's just much more difficult.
Obviously, you have people from all over the Midwest that travel here to see you specifically for your experience with Lyme disease. And for people that aren't within here in the Midwest that are seeking Lyme literate medical providers, what advice do you have? What questions should they be asking, or what should they be doing to help them identify whether or not the medical professional or they're talking to or doctor they're talking to is Lyme literate and capable of helping them?
There is an organization called iLads that will highly recommend a Lyme literate physician that has had a certain amount of experience, along with also belonging to this group. You have a lot more invested into you with the time that you spend with the patient, and also certain protocols that you use. It's not just the general medical society that we see, like internal medicine or family care.
With one of the things that you've shared with me in conversations that we've had offline is about how there's so many doctors and medical providers that are just absolutely unaware of Lyme disease because they're not taught about it in medical school.
Correct.
And in your particular case, how have you gone about acquiring your knowledge for Lyme disease identification and treatment? What is it that inspired you?
What inspired me was myself. I was unfortunately misdiagnosed having chronic
Symptoms?
mixed connective disease. And I was treated by a rheumatologist. I was also seen by internal medicine. I was seen by orthopedic. I was seen by neurology. And for the same symptoms that these individuals that are coming to me that have Lyme disease, I was tested 3 times, false negative, asking the physician to test for me over the last 20 years. And unfortunately, 4 years ago, I was positive for a few co-infections, along with positive with Lyme disease. Once I was treated, just wonderful. I have done wonderful with the protocol that I have was given and also received. And it was a battle, but patients can do that. And that is what holds special to me, is that patients need to know that.
Because I mean, I've seen you take the initiative to, like, I'm always seeing you reading articles on it. I'm seeing you scour YouTube videos and read books on the topic. And obviously, you are going way beyond what they don't teach. I mean, and I've even seen, like, doctors from other areas calling you, asking for your advice based on this. What advice would you give to other doctors who are having people coming in asking for help and think it might be Lyme disease?
1, refer if you don't feel comfortable, which I do refer on certain patients to specialists that will benefit the patient. Two, step outside the box. I was not taught this 10 years ago when I was in the nurse practitioner program. This came across on myself,
Right.
but also many other individuals, and every treatment is different. Every person is different, but just to step outside the box and think it's not just the regular disease processes that we've learned in our schooling.
Because one of the things that I actually understand why a lot of the doctors who haven't been taught information online, why they would misdiagnose. Obviously, if the testing that the insurance companies are paying for is
Correct.
not adequate, but two is the wide variety of symptoms and the range of symptoms and the ranging severity of the symptoms that the people come to you with.
Correct.
I mean, it sounds like it could be almost anything.
It's a master mimicker of so many disease processes, and you have to weed those individuals out. Not everyone has Lyme, but you definitely need to make sure they don't.
Okay. Well, are there any questions that I should have asked about Lyme disease or treatment that I haven't?
I don't believe so.
Okay. Well, thanks for coming in and sharing your story on Lyme disease treatment, and I hope it's helpful to those who are watching, and whether they're people who think they may have it, or have a friend or loved one that thinks they have it, or maybe you're a medical professional and you're getting questions from people who say that they're having issues and no one's been able to diagnose it accurately. That hopefully you now have a new resource that can be helpful to you. Thank you.
Thank you.